A documented medical case shows how dangerous cloves can be. A patient had been stable on blood-thinning medication after a heart attack. During holiday season, heavy clove use in recipes changed everything. Within 2 weeks, blood became dangerously thin. A minor kitchen cut wouldn't stop bleeding. Emergency doctors discovered clotting levels had dropped to life-threatening lows. The cause? Cloves had turned prescribed medication into a death sentence. Before we reveal these dangerous secrets, if you value your health, welcome to our community. Hit that like button and subscribe, because we're revealing critical information that could protect you. Drop your country in the comments so we can see our global health family. Your safer health journey starts here. This story isn't rare. Millions consume cloves daily, in chai, desserts, or supplements, unaware they're playing Russian roulette with medications. These tiny flower buds contain more antioxidants than blueberries and stronger anti-inflammatory compounds than turmeric. Research in BMC complementary medicine and therapies proves cloves can lower blood sugar by 27% and fight infections better than pharmaceuticals. But here's the shocking truth. The same compounds making cloves healing can make medications and foods dangerously toxic. The culprit is eugenol, comprising up to 90% of clove oil. While eugenol gives cloves their aroma and therapeutic power, it wreaks havoc with drug processing systems. Laboratory studies reveal eugenol inhibits liver enzymes metabolizing over 75% of prescription drugs. Your spice habit could be silently turning life-saving medications into health-threatening toxins. Unlike pharmaceutical drugs with warning labels, spices have zero interaction warnings, creating perfect storms of consequences. Today, I'm exposing 7 combinations that could land you in emergency rooms. These aren't theoretical. They're documented medical emergencies happening now. Whether managing diabetes, heart disease, or boosting iron levels, this information could save your life. All right, here's the countdown of 7 foods and medications you should never mix with cloves. Let's start with number 1. Blood-thinning medications. Researchers at Massachusetts General Hospital documented a dangerous clove interaction. A patient maintained stable blood clotting while taking Warfarin after a heart attack. During holidays, traditional spiced cooking nearly proved fatal. Daily clove-heavy dishes caused INR levels to jump from safe 2.5 to life-threatening 7.8. Cloves contain high eugenol concentrations with potent antiplatelet properties. Research in prostaglandins, leukotrienes, and medicine shows eugenol and acetyl-eugenol powerfully inhibit platelet aggregation through multiple pathways. They block thromboxane formation while increasing compounds preventing blood clots. Combining cloves with anticoagulants like Warfarin, clopidogrel, or Aspirin creates double blocking effects on clotting systems. Clinical studies show this combination increases bleeding risk by 300 to 400% versus medication alone. Even small culinary clove amounts can measurably alter bleeding times in patients taking blood thinners. Effects are cumulative and persistent. Eugenol has 14 to 18-hour half-life in bloodstream. Dinner cloves still affect morning medication potency. Patients experience stacking effects, where daily consumption gradually builds anticoagulant activity over weeks. The European Medicines Agency documented serious bleeding complications when patients combine spice consumption with anticoagulant therapy. Internal stomach bleeding, brain hemorrhages, and unstoppable surgical bleeding linked to this interaction. The American Journal of Health System Pharmacy identifies cloves among herbs most likely potentiating warfarin effects. Healthcare providers miss this interaction because patients don't mention cooking habits during consultations. natural equals safe assumptions create dangerous medication management blind spots. If taking anticoagulant medications, strictly limit cloves to tiny flavoring pinches only. Completely avoid clove supplements, concentrated teas, or essential oils. Always inform healthcare teams about all consumed substances, including seemingly harmless cooking spices. Next, Interaction 2. Diabetes medications. A documented case shows diabetic complications. Repeated severe hypoglycemia episodes, leaving a patient confused, trembling, requiring emergency intervention twice. As a well-controlled type 2 diabetic on metformin and insulin, the patient thought drinking clove tea twice daily was beneficial. This unknowingly created perfect storms for dangerously low blood glucose. Cloves' anti-diabetic effects are well documented. The landmark BMC Complementary Medicine and Therapies study found polyphenol-rich clove extract reduced post-meal blood glucose by 21.5% in healthy individuals and 27.2% in pre-diabetics. Effects work through multiple mechanisms, slowing intestinal glucose absorption, significantly reducing liver glucose production, dramatically boosting muscle glucose consumption. Problems arise when powerful effects combine with diabetes medications designed for identical goals. Concentrated clove tea alongside prescribed medications means taking multiple glucose-lowering treatments simultaneously. Research demonstrates cloves' active compounds sustain anti-hyperglycemic activity for hours, meaning effects overlap and amplify pharmaceutical interventions. Clinical evidence from Journal of Ethnopharmacology shows clove extracts reduce hepatic glucose production by 40%, the same pathway metformin targets. Combined, this dual suppression drives blood glucose into dangerous territory. Cleveland Clinic specifically warns, combining eugenol with insulin medications may cause blood sugar levels to drop too low, emphasizing severe hypoglycemia can be life-threatening. This interaction is particularly treacherous due to unpredictability. Unlike standardized pharmaceutical dosing, cloves' glucose-lowering potency varies dramatically based on preparation method, concentration, individual metabolism. Some people experience dramatic drops with small amounts. Others tolerate larger quantities. But variability makes safe dosing impossible. Clove-induced hypoglycemia symptoms can be severe: confusion, rapid heartbeat, excessive sweating, emergency glucagon requirements. For diabetics with carefully calibrated medication regimens, introducing powerful glucose-lowering spices disrupts delicate balance and renders standard carbohydrate counting unreliable. If diabetic taking glucose-lowering medications, use cloves only in minimal culinary amounts and monitor blood sugar obsessively. Completely avoid supplements and concentrated preparations. Next, Interaction 3. Iron-rich foods and iron supplements. A clinical study in anemia treatment discovered an unexpected challenge. Despite prescribing iron-rich diets and supplements, several patients weren't responding to treatment. After investigation, researchers discovered many consumed clove-spiced foods and teas with iron-rich meals, unknowingly sabotaging their body's mineral absorption ability. The interaction centers on compounds called tannins, substances giving cloves their astringent, bitter taste. Research in current developments in nutrition reveals tannins are among the most potent non-heme iron absorption inhibitors, the type found in plant foods and supplements. These polyphenolic compounds bind directly with iron in digestive tracts, forming insoluble complexes bodies cannot absorb. Clinical studies demonstrate tannin consumption can reduce iron absorption by 60 to 90%, depending on concentration and timing. Drinking clove tea with iron-rich meals like spinach salad or taking iron supplements with clove-spiced food neutralizes much iron bioavailability. Cloves contain some of the highest tannin concentrations among common spices, making them especially potent iron absorption inhibitors. Timing aspects are crucial. Research shows iron absorption can be impaired for up to 2 hours after tannin consumption, meaning clove-containing foods or beverages consumed before iron-rich meals can still interfere with mineral uptake. This extended interaction window catches many off guard, as they assume 30-minute food separation provides sufficient protection. For individuals with iron deficiency anemia, this interaction can significantly delay recovery and mask treatment effectiveness. The Canadian Digestive Health Foundation emphasizes tannin-rich foods should be spaced from iron-rich meals by at least 1 to 2 hours, preventing interference. This is especially important for vegetarians and vegans, who rely primarily on non-heme iron sources more susceptible to tannin interference than heme iron found in meat. Impact extends beyond iron pills. Foods like dark leafy greens, legumes, fortified cereals, and dried fruits lose much nutritional value when consumed with clove-containing preparations. To maximize iron absorption, avoid consuming cloves within 2 hours of iron-rich foods or supplements. Next, Interaction 4. Calcium-rich foods and dairy products. Research studying digestive health uncovered concerning patterns. Patients regularly consuming clove-spiced chai lattes and clove-containing beverages with dairy products were experiencing unexpected digestive issues and mineral imbalances. Investigation revealed complex interactions between cloves' bioactive compounds and calcium absorption most people never consider. The relationship between cloves and calcium absorption is multifaceted and subtler than other interactions. While cloves don't directly block calcium absorption like iron, they interfere with the body's ability to effectively utilize calcium once absorbed. This occurs through cloves' effects on digestive enzymes and gut bacteria, which play crucial roles in mineral metabolism and bone health. Research in European Journal of Clinical Nutrition shows certain polyphenolic compounds found in high clove concentrations can bind with calcium and other minerals in digestive tracts. This binding doesn't prevent absorption, but alters uptake rate and efficiency. When consumed regularly with dairy products or calcium supplements, this leads to suboptimal calcium utilization over time. Concerns become particularly relevant for individuals at osteoporosis risk or taking calcium supplements for bone health. A Journal of Bone and Mineral Research study found compounds similar to those in cloves can interfere with calcium incorporation into bone tissue, even when blood calcium levels appear normal. Standard calcium blood tests might not reveal subtle but significant impacts of regular clove consumption on bone health. Furthermore, cloves' high tannin content affects gut microbiome, which plays increasingly recognized roles in calcium metabolism. Beneficial bacteria in intestines help convert calcium into forms bodies can more easily utilize. When tannins from cloves regularly alter bacterial balance, it has downstream effects on mineral absorption and bone health. Timing aspects are equally important. Many people enjoy clove-spiced beverages like chai or golden milk as calcium-rich drinks, combining milk with warming spices. However, this combination may reduce calcium benefits they're seeking. For optimal calcium absorption, avoid consuming high clove amounts with dairy products or calcium supplements. Next, Interaction 5. Liver-Metabolized Medications. Researchers at Johns Hopkins encountered a puzzling case that changed understanding of herb-drug interactions. A patient taking cholesterol and anxiety medication experienced unexpected drug effectiveness changes after starting daily clove supplements. Blood tests revealed altered medication levels unexplainable, until researchers discovered the patient's concentrated clove extract routine. Understanding this interaction requires knowledge of the liver's cytochrome P450 enzyme system, complex protein networks responsible for metabolizing over 75% of prescription medications. Groundbreaking research in Saudi pharmaceutical sciences demonstrates eugenol significantly inhibits several crucial P450 enzymes, including CYP2C9, CYP2D6, and CYP3A4. These enzymes break down hundreds of common medications. When eugenol inhibits these enzymes, medications normally processed and eliminated from bodies begin accumulating. This creates unexpectedly high drug concentrations in bloodstreams, essentially creating overdose situations even with normal prescribed doses. The study found eugenol could reduce enzyme activity by 40 to 67%, depending on concentration. Clinically significant inhibition altering drug effectiveness and safety. Medications most affected include commonly prescribed drugs like statins for cholesterol, certain antidepressants, blood pressure medications, and anti-anxiety drugs. If taking atorvastatin for cholesterol and regularly consuming clove supplements, the statin could accumulate to dangerous levels, potentially causing severe muscle damage or liver problems. Similarly, antidepressants like sertraline could reach toxic concentrations when combined with regular clove consumption. This interaction is particularly dangerous due to unpredictability. Effects depend on individual genetic variations in enzyme production, clove amounts consumed, and specific medications involved. Some people might experience dramatic drug level changes with small clove amounts, while others tolerate larger quantities without obvious effects. This variability makes it impossible predicting who will be affected and how severely. The interaction isn't limited to supplements. Even regular consumption of clove-heavy foods can affect medication metabolism. If taking prescription medications, especially those with narrow therapeutic windows, avoid clove supplements and limit concentrated clove preparation consumption. Next, Interaction 6. High-fiber foods and digestive medications. A clinical study in digestive health noticed unusual patterns among patients following high-fiber diets. Those regularly consuming clove-spiced foods alongside fiber-rich meals were experiencing unexpected digestive discomfort, bloating, gas, altered bowel movements that contradicted fiber's typically beneficial effects. Investigation revealed lesser-known interactions between cloves and digestive processes. The interaction stems from cloves' potent antimicrobial properties, which disrupt delicate beneficial bacteria balance in digestive systems. Research in Journal of Applied Microbiology shows eugenol exhibits broad-spectrum antimicrobial activity, effectively killing both harmful and beneficial gut bacteria. While this property makes cloves useful for fighting infections, it can eliminate beneficial microbes responsible for fermenting fiber into health-promoting short-chain fatty acids. When consuming high-fiber foods like beans, whole grains, or vegetables along with significant clove amounts, the spice interferes with gut bacteria's ability to properly digest fiber. Instead of smooth fermentation that typically occurs, undigested fiber accumulates in colons, leading to excessive gas production, bloating, and digestive discomfort. This creates paradoxes where healthy, high-fiber foods begin causing symptoms they're meant to prevent. Impact extends to digestive medications. Many people taking probiotics or digestive enzymes to support gut health may find supplements less effective when consumed with clove-rich foods. Studies indicate cloves' antimicrobial compounds can neutralize beneficial bacteria in probiotic supplements within 30 minutes of consumption, essentially wasting therapeutic investments. Furthermore, medications for digestive conditions like irritable bowel syndrome or inflammatory bowel disease can be affected. Drugs, depending on specific gut bacteria for activation or absorption, may become less effective when microbial environments are disrupted by cloves' antimicrobial activity. Timing of fiber and clove consumption is crucial for maintaining digestive health. Research suggests spacing high-fiber meals and clove consumption by at least 2 to 3 hours can minimize this interaction. To optimize digestive health, avoid consuming concentrated clove preparations with high-fiber meals or probiotic supplements. Next, Interaction 7. Alcohol and certain beverages. A clinical study on traditional spice and alcohol combinations discovered alarming interactions. Several patients reported unusual reactions to mulled wine and spiced cocktails containing cloves, symptoms ranging from severe flushing and rapid heartbeat to dangerous blood pressure drops. Research uncovered potentially serious interactions between cloves and alcohol that most consumers never consider. The interaction centers on cloves' ability to affect alcohol metabolism in the liver. Eugenol significantly inhibits aldehyde dehydrogenase, a crucial enzyme responsible for breaking down acetaldehyde, the toxic byproduct of alcohol metabolism. When this enzyme is impaired, acetaldehyde accumulates in bloodstreams, leading to characteristic alcohol intolerance symptoms: facial flushing, rapid heartbeat, nausea, and headaches. Research in Journal of Ethnopharmacology demonstrates eugenol's inhibition of alcohol. Metabolizing enzymes can increase acetaldehyde levels by 40 to 60% compared to alcohol consumption alone. This means single glasses of clove-spiced mulled wine could produce toxic effects, equivalent to consuming significantly more alcohol. For individuals with existing alcohol sensitivity or taking medications affecting alcohol metabolism, this interaction can be particularly dangerous. Effects are dose-dependent and cumulative. Traditional holiday beverages like mulled wine, spiced rum punches, and clove-studded hot toddies contain concentrated amounts of both alcohol and cloves, creating perfect storms for this interaction. Even small amounts can trigger symptoms in sensitive individuals, while larger quantities can cause severe reactions including vomiting, chest pain, and dangerous blood pressure fluctuations. Beyond immediate symptoms, this interaction has long-term liver health implications. When acetaldehyde accumulates due to impaired metabolism, it causes increased oxidative stress and inflammation in liver cells. Regular consumption of alcohol-clove combinations could potentially accelerate liver damage, particularly concerning for individuals with existing liver conditions or taking hepatotoxic medications. Cultural and traditional medicine practices often combine cloves with alcohol for therapeutic purposes, but these combinations should be approached with extreme caution. If you consume alcohol, avoid clove-spiced alcoholic beverages entirely. Be particularly cautious with seasonal drinks and cocktails containing cloves. Next, safety recommendations. As we've journeyed through these 7 critical interactions, one thing becomes crystal clear. The small, aromatic clove bud packs far more biochemical power than most people realize. From dangerous blood clotting incidents to hypoglycemic episodes, these documented examples demonstrate that natural doesn't always mean safe when it comes to food and drug interactions. The key takeaway isn't to fear cloves or eliminate them entirely. These remarkable spices offer incredible health benefits when used appropriately. The antioxidant content in cloves surpasses most superfruits, and their anti-inflammatory properties are well documented in medical literature. The goal is informed, safe consumption that maximizes benefits while avoiding potentially dangerous interactions. Here's your practical action plan. First, if taking prescription medications, especially blood thinners, diabetes drugs, or liver-metabolized medications, limit cloves to small culinary amounts only. Second, Create timing buffers around mineral-rich foods and supplements. Space iron-rich meals and clove consumption by at least 2 hours, and apply the same principle to calcium supplements and dairy products. Third, pay attention to your body's signals. Unusual bruising, unexplained blood sugar fluctuations, digestive changes, or unexpected medication effects could indicate problematic interactions. Document symptoms and discuss them with your healthcare provider, always mentioning spice consumption habits. For those managing chronic conditions, consistency is crucial. Your healthcare provider has calculated medication dosages based on expected metabolism and absorption rates. Introducing variables like concentrated clove consumption can disrupt this carefully balanced equation, potentially rendering treatments less effective or causing dangerous side effects. The supplement industry often markets clove extract and essential oils as natural health solutions, but concentration matters enormously. A clove supplement can contain 50 to 100 times more active compounds than culinary use, dramatically increasing interaction potential. Finally, become an advocate for interaction awareness. Share this information with friends and family, especially those managing diabetes, heart conditions, or taking multiple medications. Knowledge is your best defense against potentially dangerous interactions. If this video helped protect your health or that of a loved one, kindly type YES in the comments. It motivates us to continue researching and sharing crucial information that could literally save lives.